Upper cross syndrome is a pattern of muscle imbalances that we see commonly in the office that can lead to neck pain, shoulder pain, back pain, that sort of thing. If you didn't see our original video on it, please check that out for some good background info. But just to sum things up for you, this pattern, we see a combination of muscle tightness and muscle weakness. We see tightness in the upper trap, that neck area into the upper portion of the upper back, and then subsequent crossed tightness into the front of the shoulders, anterior pec area. Then we see some muscle weakness or inhibition of the lower traps and the deep neck flexors. So when exaggerated, we find ourselves in this position right here. So it's important that we work on restoring those muscle imbalances. In this video, we're going to go over a couple exercises to strengthen those weakened or inhibited areas. And once again, that's going to be that lower middle trapezius area, those muscles that stabilize the shoulder blades, and the muscles in the front of the neck, those deep neck flexors. So in upper cross syndrome, part of the imbalance that occurs is we have a weakening or an inhibition of these lower and middle trap muscles. So what we want to do is we want to kick start some of that muscle activation, get the neurology working to that area. So we're going to get into this position that Zach is in right now. Elbows are on the floor. We want to make sure that the shoulders are down away from the ears and neck is elongated, chin retracted. If the shoulders are up by the ears, then we're going to be overactivating these upper trap muscles and just feeding into that dysfunctional pattern that we want to work our way out of. So we're here, shoulders down and back, and then all he's going to do is he's going to push his wrist into the band right there, feeling these muscles kick on and activate. This looks extremely simple, but I promise you it is much harder than it looks if you do it correctly. In upper cross syndrome, we also talk about an inhibition or weakening of these deep neck flexor muscles. So this is a really good exercise to get those engaged. So you're just going to put your forearms on the wall, band around the back of your head, and you're simply going to retract your chin or try to push the back of your head into the band. It's kind of a funny looking motion, but while you do this, you are going to naturally activate those muscles in the deep front portion of the neck. And you notice as he's forward, that mimics that forward head posture of the upper cross syndrome. But as he brings it back, that's the part of the motion that we're really focused on. It gets you out of that position into a good, nice aligned posture. So if you're experiencing neck pain, shoulder pain, back pain, it could be the result of some of these imbalances that we mentioned here. So if you're experiencing pain, it is important that you be seen by a medical professional before trying to address any of these issues on your own. And we would be happy to help. Visit us online at TruMotionTherapy.com to learn more or book an appointment.